Cold or RSV, interpreters need to know. Why does one child stay home with soup and tissues while another may need oxygen or even hospitalization? And most importantly, what terminology and concepts should healthcare interpreters understand to accurately interpret these encounters? In today's video, we'll compare the common cold and RSV from an interpreter's perspective using in real-life examples, medical terminology, and patient-provider scenarios. Let's get started. The common cold is a viral infection affecting the upper respiratory tract. When we say upper respiratory tract, we mean primarily nose, sinuses, throat. Many different viruses can cause a cold. Children may get 6 to 8 colds each year, sometimes even more. The common cold is actually caused by over 200 different viruses. The most common type is the rhinovirus. These viruses are very hardy and can survive for hours on surfaces. Cryza is a medical term for what most of us simply call a cold. It refers to the inflammation of the mucous membranes lining your nasal cavity. When a virus enters the lining of your nose, your immune system reacts immediately. It sends more blood to the area to transport white blood cells. This extra blood flow causes the tissues to swell, and this swelling is what makes your nose feel stuffed and hard to breathe through. The body also produces extra mucus to trap the virus and flush it out of your system. Common cold symptoms include runny nose, sneezing, nasal congestion, mild sore throat, mild cough, low-grade fever, fatigue. Children may feel miserable, they may be tired, they may have a stuffy nose, but usually they are still drinking fluids and maintaining normal oxygen levels. Common cold symptoms are usually mild and go away after several days to a week. What is RSV? Respiratory syncytial virus, RSV, is a common respiratory virus that usually causes mild cold-like symptoms. Remember, similar symptoms. At first, RSV and the common cold can look a lot alike: nasal congestion, runny nose, and coughing. But RSV quickly escalates to higher fevers, 100 to 102 degrees Fahrenheit, persistent cough, wheezing, and labored breathing. Who is at risk? While it causes mild cold-like symptoms in healthy adults, it can cause severe lower respiratory tract infections in high-risk groups: infants under age 1, adults over 65, and people with poor immune systems. Because RSV and the common cold have similar symptoms, it can be tough to know when to seek medical care. But if your fever reaches 102 degrees Fahrenheit, especially if medication isn't bringing it down, it's time to see a doctor. RSV can also cause more severe illness such as bronchiolitis, inflammation of the small airways in the lungs, and pneumonia, infection of the lungs. 2 to 3 out of every 100 infants under 3 months are hospitalized with RSV every year. Those who are hospitalized may require oxygen, IV fluids, if they aren't eating and drinking, and mechanical ventilation, a machine to help with breathing. RSV immunizations are available for both infants and adults to prevent severe respiratory disease. Adults receive a direct vaccine, while infants are protected either by vaccinating the mother during pregnancy or by giving the baby a preventive antibody shot after birth.